This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended. Hello my dear friends, this is Dr. Magan Patel Eye Care and Laser Center. In this video I want to show you why should you learn direct phaco chop for phacoemulsification. Direct chop is highly efficient in creating a crack and separation, because chop actually having two components. One is creation of crack and then creating or separating the fragments. So if we talk about efficacy, we talking about maximize mechanical energy and minimize phaco energy in order to achieve phaco chop. Now if you see in case of stop and chop, trenching needs continuous mode phaco to thin out the endonucleus. Mechanical separation is used at the end to achieve the crack. Therefore, the trenching for the chop, phaco energy 90%, mechanical energy 10%. If we move on direct chop, short burst of phaco energy in micropulse mode for grade 2 or less cataract, multi-burst mode for grade 3 or more cataracts, and this will define that the efficiency is greatly increased because mechanical energy used close to 60 to 70% and phaco energy 30 to 40% in creating the crack and fragments. Let me explain this concept in this video. This is grade 3 sclerotic cataracts, looks white. I inject dispersive viscoelastic. I choose horizontal chop. In this case, I bury the phaco tip with stiff angle. Once I lollipop the nucleus, I crack the nucleus. Crack is only created by the mechanical force, and also lateral separation also by the mechanical force. There is no use of any ultrasonic energy. Only time I use phaco energy when I buried the phaco tip, I use short burst of phaco power. So this is the most efficient way to minimize the phaco energy. Now we can break the nucleus in multiple fragments, 6 to 8 fragments. Fragments depends on the hardness of the cataract and size of the CCC. If cataract is hard, you make more fragments, and if CCC is small, you create a more small fragments. And to protect the endothelium, appropriate use of dispersive viscoelastic substance. Once you create 6 to 8 fragments of the nucleus, you start the remove the fragments by the fragments mode, and you bring the fragments in the center and emulsify the piece in the center. In fragments mode, you use only torsional phaco. Because of the torsional phaco, there is no repulsion, so every time your nucleus piece remains around your phaco tips, so no need of to chasing the piece. So also phaco burns is also very less, and by this way we minimize the phaco energy because there is no cortical material to take care to remove the last piece. This is one more case of the hard cataract, black cataract. I choose horizontal chop in this case. I buried the phaco tip in stiff angle. I engage the chopper just in front of the phaco tip and bring the chopper toward the phaco tip and create a crack and lateral separation. This both action by the mechanical way. There is no use of phaco energy. I use phaco energy only by engage the phaco tip. Once I engage the phaco tip, I bring the chopper toward the phaco tip and break the nucleus in the piece, and this way you create a 6 to 8 piece of the nucleus by the same way, and lateral separation. While doing the lateral separation, you bring the chopper toward the phaco-tip as well as downward movements. This is sometimes some kind of leathery cataracts, and once you convert in the 6 to 8 piece, start in the phaco-fragment mode and remove the fragments, and you emulsify the pieces at the level of the iris to protect the posterior capsule, and by this way we can save a lot of phaco energy and create a safe surgery. Thank you for watching this video.